Howdy, I'm Haugh, running as a Libertarian for U.S. Senate in North Carolina in 2014. My views on our healthcare programs were very deeply informed when I had a job at Duke Hospital helping people with their insurance paperwork. I saw firsthand what bureaucratic hell Medicaid patients had to go through just to maintain the most substandard benefits America has to offer. As a Libertarian, I definitely want to reform and eventually eliminate federal involvement in healthcare. But I'll be damned if I'm going to throw grandma out the street to accomplish that. We always have to keep our focus on just who we're trying to serve. Any reform has to be centered around how it affects the end users. There are real people dependent on these programs now. We can't just ignore our responsibility to them. We can't solve their problems with just ideology. These solutions also demand compassion and a constant focus on the results. We can't claim to have accomplished anything if we don't actually reduce human suffering. We could save a lot of money right now on Medicaid and Medicare just by cutting out a lot of the bureaucratic nonsense we require from both patients and doctors. We can reduce these budgets while increasing the amounts that actually pay for patient care. Right now, we're doing a terrible job of paying providers enough to want to see Medicaid patients. Healthcare is one of the most hyper-regulated industries in America today. There are so many obstacles we could remove to allow private providers of all kinds to flourish. In so many ways, they can do a much better job of taking care of people than government could at a much lower cost. We could give people better choices than Medicaid if we simply got out of the way of those who would provide them. As this free market system grows, government can withdraw. I'm Haugh. To your health.